The essence of the personality of cannabis sativa can be expressed in one word very clearly: flirt.
The cannabis child is the happy-go-lucky type who prefers and is comfortable in company, especially of the opposite sex. He is very friendly, extroverted, and mixes up very easily with people. He enjoys to be amongst people, in groups, and talks vividly and animatedly. From early childhood, they laugh loudly and openly.
They like to do things which have an element of excitement and thrill about them. As they grow further into teenage or adolescence, the attitude is to enjoy every second of life. They want to live in a constant state of ecstasy and be away and unrelated to the world in general. This is similar to the state produced by the narcotic drug ecstasy, which is now the rage all over the world and is easily available to teenagers and young adults who frequent discotheques and nightclubs. These are the people who like to go out to dance parties and have fun every night. Medhorinum. This attitude and behavior typifies the cannabis personality.
They are very sexually oriented and are of amorous disposition right from young age to old age. They become sexually active from the very young age. In childhood, they enjoy playing intimate games like Doctor Doctor or games where they act as husband and wife. In adulthood, they have many girlfriends and they have regular sexual relationships. These relationships give them a lot of enjoyment, excitement, and give them a feeling of happiness. Cannabis sativa spends money very easily in pursuit of pleasure.
They are occupied with thoughts of sex, but with little clarity. And that is why they soon get into a state of confusion. Due to this confusion, they make mistakes in writing. They omit words, repeat words, and cannot correlate with time. They keep on repeating the same mistakes right from childhood till old age. They remain buried in thoughts always. They are not able to understand their own self, like the autoimmune response in cases of rheumatism is at the pathological level. Here, the autoimmune response is at the psychological level. This is an important remedy for children and adults who give wrong answers to the questions. The confusion is so much that even her own voice appears strange. They hear strange voices from a distance, and others' voice appears strange to them.
Due to the varied and excessive sexual activity and during the phase of happiness and enjoyment, if they suffer from gonorrhea, the gonorrhea is suppressed, they develop either bronchial asthma or emotional disturbances.
Gonorrhea, once suppressed, can express again and again because of the body's natural vitality and capacity to react. Suppression of the acute expressions of gonorrhea gives rise to other chronic recurrent expressions. After suppression, another physical complaint which can develop is opacity of the cornea and total or partial blindness. This blindness is very difficult to treat with any system of medicine.
At the mental level, this suppression expresses in the form of schizophrenic response or hysterical response. The schizophrenic response is associated with a lot of liveliness, excitement, and alternative with a phase of depression and sadness.
The confusion progresses deeper and deeper, and they start seeing spirits, ghosts, and specters. They behave in a foolish way in front of friends and relatives. They do many silly things which can't be explained or understood. Their confusion is so pronounced and deep and psychotic that they develop an antagonism to their own self. They make many mistakes in relation to time. The time too passes slowly.
The dreams also express such a mental state. The dreams are disappointment in everything. Distances appear strange. Confused dreams. Frightful dreams. Unpleasant dreams. Nightmares.
They develop delusion about their own voice, vision and judgment, and the distance appears as if it has doubled. They develop a marked aversion to bed and have a strong desire to go out.
Nightmares are so vivid that he wakes up from a sleep with a start. The patient gets up as if he has received an electric shock. Soon they avoid going to sleep due to the fear and anxiety of nightmares. In fact, cannabis sativa doesn't sleep because of two reasons. One, because of excitement in teenage. Second, because of fear in childhood or adulthood.
The second phase of hysterical behavior is expressed by laughing loudly, spasmodically and immoderately. They laugh so much that they turn blue with laughter. Laughing alternates with weeping. Depression. A person who was industrious develops an aversion to work, indolence and anxiety about health. During this phase of depression or hysteria, they get a sensation as if water is dropping on the head, in the brain, in the heart, and in the anus. They develop tremendous fear, anxiety, especially in the stomach, along with a feeling of nausea. During the phase of depression, the slightest mental exertion aggravates the patient's condition.
Feeling of stitching pain all over the body, as if thousands of needles are pricking them. This sensation develops specially at night when they are alone. They develop a sensation of choking on swallowing. At the physical level, the most important system which gets involved is the respiratory system. There is a stuttering respiration with marked palpitation. The patient must stand up with his hands supported on his knees. Cough with viscid expectoration. Heaviness of the chest forces the patient to breathe deeply. Asthma and bladder troubles are concomitant to each other. The next important system which gets affected is the urinary tract.
There is a marked burning during and at the end of urination. Urine is usually retained and a few drops pass after completion of urination. There is a painful urge to pass urine. The urine passes in split streams, puja. In the entire urinary tract, there is soreness and burning, which extends to the bladder while urinating. Spasmodic closure of the sphincter while urinating and zigzag pain while passing urine along the length of the urethra. Phimosis in children and young adults. It is one of the important medicines for cystitis, urethritis and prostatitis.
The most characteristic symptom in old people is that they always walk with their legs apart in the shape of a bow. As the testes become so sensitive, they cannot bear it to touch the thighs. The males, after having abused their sexual capacity, develop impotency at a relatively younger age.
The flirt develops frequent erections, sexual overexcitement during young age. Because of repeated infections, there's marked swelling of the prepuce. Physical exertion gives amenorrhea and constipation. The psychotic laxity is also observed in the lower limbs, where the patient develops dislocation of patella while going upstairs. There is a pressure from behind the eyes in the forward direction. They can develop an aversion to meat. The patient develops weakness +3 after eating.
It is remedy which predominantly expresses psychotic, tubercular and syphilitic conditions. The general aggravations are alcohol +3, tobacco +3, constipation, exertion, lying down, going upstairs, motion, urination, talking, standing, after dinner.
The patient is ameliorated by uncovering, standing in asthma, remaining quiet, expectoration,